In expressing my thanks, may I just say that I'm glad you're having this conference, and I congratulate the CLC in sponsoring it. I am concerned, as many people are, about Medicare, not with its fundamental principles, but with the problems which we knew would arise. And those of us who talked about Medicare back in the 1940s and 50s and 60s kept reminding the public that there were two phases for Medicare. The first was to remove the financial barrier between those who provide health services and those who need them. We pointed out repeatedly that that phase was the easiest of the problems we would confront. In governmental terms, of course, it means finding revenue, it means setting up organizations, it means exercising controls over costs. But in the long term, it was the easiest problem. That phase number two would be the much more difficult one. That was to alter our delivery system so as to reduce costs and so as to place the emphasis on preventive medicine. But I think what we have to apply ourselves to now is the fact that we have not yet grappled seriously with the second phase. We must now move increasingly toward group practice, whether it's community clinics, cooperative clinics, clinics set up by the doctors themselves, but the need for group practice so as to make possible the practice of preventive medicine. Only in that way are we going to be able to keep the costs from becoming so excessive that the public will decide that Medicare is not in the best interests of the people of this country. It is time that we took a look at it to see whether or not we're carrying out the vision that was contained in the report of Mr. Justice Emmett Hall. And I was delighted when Mr. Crombie, the Minister of National Health and Welfare, appointed Mr. Justice Hall to do a review of this whole question. I have complete confidence in his competence and in his integrity. And I know that when we get that report, we will then have a blueprint on which we can work in Canada together, irrespective of party or regional area or profession or interest, to work together to make Medicare what it was intended to be, a program that would provide in Canada a society in which we had freedom from fear and freedom from want. And I hope from time to time we will gather, as we're gathering now, to the end that we may be able to build in Canada a program which will provide the maximum amount of good health, enable people to enjoy good health, provide them with remedial services when that good health is no longer present, and to do that without any fear of the financial burdens which have crippled so many people in other places and in other times. Thank you very much for your tribute, and thank you for inviting me to be here. May I wish you well in your deliberations now and in your performance to perfect Medicare in the future. Thank you very much.